All right, we will continue on now back as the Board of Supervisors with item 610, our 11 a.m. item, presentation of Health Services Director Anthony Arton's work plan for fiscal year 24-25. Good morning, Director.
Good morning. All righty. Well, good morning. Thank you for having me. Happy to be here. Happy to be your guys' director. So today I just wanted to present to you a quick little report on my first 3 months. As promised during my interview, I said I'd write up a quick little SWOT analysis for you guys and then just give you an update on the work that's been happening and what we're planning on doing moving forward. Oh, what button? Enter? Okay. So a couple strengths. So we got a nice little base here. Our staff are kind, they're caring, they're dedicated, and they're thirsty for improvement. As you guys know, most of our staff are pretty new. We only have a few staff members that have more than 5 years of experience, and almost all of our management team is new within like the last couple of years. So there's a good opportunity to help mold them and get them going in the right direction. Our community partners are excellent. There's a lot of resources out there. It's just really about collaborating with them and getting them coordinated and all moving in the same on the same page. But yeah, they're willing and they're wanting to help. I think they understand kind of the issues that are going on with the Health Services Department, and we're getting a lot of help from a lot of different agencies. And I want to thank Director Jones for her help from Behavioral Health. We have a lot of good collaboration going on with her already. Weaknesses. Several. So as you guys are aware, the policies and procedures are very out of date. A lot of our policies and procedures are more than 10 years old. The county policies are great, but internally there's a lot of work to be done, and so we're doing our best to assess that and start moving forward. There's also several things that are out of regulatory compliance, just from a basic lack of awareness. You know, what you don't know is what you don't know, and unfortunately, there are some programs that we've had to put on pause because of that. Workforce development, our recruitment, as you guys are probably aware, suffers. The hiring process is pretty inefficient. Our training and onboarding is poor, and there's numerous vacancies and a lack of direction and vision. So this is something that I've been putting a lot of my time and energy into already. Our internal HR person, Ash, has been doing a good job. And he just gave me, hopefully, updated policies and procedures on our recruitment and our onboarding process. So that's something that's being addressed, hopefully, in the near term. Fiscal budget. Although there seems to be a fair amount of resources for us to be able to operate, one of them is under threat right now. But there's a lack of awareness on their programs and their budgets. There's no quarterly reporting. So it's been hard to make decisions sometimes. Especially for long-term planning without a good awareness of where we're at, what funding's not going to be there in a couple of years. So it keeps me, a little bit awake at night. But that's something that, again, that we are addressing as well. So there's a lack of revenue-generating services. A lot of the services that we provide for free, that's great. It's mostly education, but we're not doing like private immunizations, and that sometimes can cause an issue, and there's not any revenue to be collected from that. So that's something that we're going to be looking at. And when I think vaccinations, I think of the public health department. So we do the VFC program and the 317 program for Medi-Cal, but again, we're not billing for it. That's free. But there's an opportunity there to try to generate some revenue for the department. When I came on, the organizational chart was disorganized. There's a lack of understanding of who reports to who, several staff with multiple supervisors. That still continues on a little bit, although we've got that narrowed down to just one person at this time. She's just basically filling dual roles. But that's something that I dislike in an organization chart, having two supervisors. I always think of office space, office space, where you have 5 people coming and saying, you didn't do your TPS report. So. The building, it's hazardous. It's overloaded with material. It's a little bit of a fire hazard. There's a lack of space. We were in the process of hiring. We might have to put a little bit of a pause on that right now. But yeah, it's also a poor location. We're right next to probably our largest competitor. So, and although they do great services, not exactly ideal if you are trying to, start services that generate revenue in the future. Our HVAC and our roof are overall in poor condition, so there's a lot of work to be done with our building as well. And then our equipment, most of it's older, slower equipment. Software's out of date, as you guys know, and I appreciate. Thank you for approving a new AHR for environmental health last week, but there's also some more EHR that we're probably going to have to do, especially if we move towards billable services. So I apologize if this comes off as mostly negative, but I wanted to give you guys an honest assessment. So opportunities. Utilize grants, funding to recruit new positions, fill vacancies, update software, expand services, and position Lake County Health Services for long-term viability. So, and then I've been working very hard since day one to kind of transform the culture there, set a vision, give direction, update policies, and do a reorg of the organizational chart. So, and building relationships. Threats. Unfortunately, this one is coming to realization. The downturn in the economy, especially here in California, is likely going to impact our funding. I believe I updated you guys with that last Thursday or Friday. External threat actors targeting counties and health departments. So that's like our cybersecurity threats. So that's been on the increase. In my prior position, we were hit, and so that was a really rough couple months. So those threat actors are out there, and they are trying to target health departments. So obviously disasters, that's probably no surprise to you guys. Many wildfires have happened here in the last 5 to 6 years. And then again, space on our building. We're running out of space. So right now, our vision is to become more of a service delivery public health department. Again, we're pretty heavy on the education and the administrative side of things, but I'd really like to start some more basic services for the people and try to get out in the community more. Within the first 6 weeks, I think, of being there, we took the work that Susan was able to do prior to my arrival. She did an all-staff meeting all day and kind of ironed out some 3 key priorities, so we turned those into a strategic plan. So naturally, this is addressing a lot of those threats. Workforce development is the number one. Financial sustainability, going to be a little bit more of a challenge now, but that's definitely high on our radar. And then the external and internal communication. And then our internal communication is being addressed right now. We've started an all staff drive. We're posting our minutes for management meetings so that all staff can see what's going on with their leadership. So, and then I'm sending out monthly communications to all the staff so they know what's going on and keep them updated. So some of our accomplishments so far, this is my favorite little win that I've had so far in the first 3 months is the new program accounting sheets. When I came on, we were spending a lot of money on a new software system. You would think going electronic is probably the most effective and easiest, but this was not the case. It was causing a lot of the staff to spend 2 to 3 hours a week updating their program sheets. In public health, our timesheet accounting can be a challenge because sometimes you have to enter notes for service for certain programs. You have to account like every 15 minutes, and there's not like one revenue. So you have to account your time to certain grants or certain contracts. So it gets a little dicey. So we created program sheets that are Excel sheets. It's just much simpler. And so far that's been a hit, it seems like. Again, I mentioned this, we have our strategic plan. We created the all-staff drive so that people have access to leadership team meeting minutes and documents that need to be between environmental health and public health. So there was a little bit of silo happening. So we wanted to make sure that staff had all access to our documents. I finished one-on-ones with every staff member. I met with everybody for about 30 minutes to get to know them, get to know what drives them, what they like to do. So just kind of building that relationship and the rapport with the staff. In the process still of meeting with community stakeholders, I've got probably almost all the fire departments done, I think, at this time. And then I have meetings coming up with the CEOs of the hospitals and tribal health, and any positive changes, some other community partners that are out there, Hope Rising and stuff like other organizations like that. We have updated our emergency procedures and policies. Obviously, I think that's a high priority, making sure you know what to do in an emergency. So we did get that completed. Trevor, our PIO, has updated a communication plan again, addressing some of the internal communication issues that the agency's having. A couple weeks ago, we were awarded the mobile outreach clinic. That's a large van that's going to go all throughout the county. So that'll help kind of address some of the building issue in our location, so we can kind of go where we want to now. And that's great for health equity, so we can get to some populations that may not be getting reached. And then our home visiting team had their first client. So that's good. That's a new program that we've started recently. And that's a big, up in Oregon where I'm from, that was a big hit up there. It's a really great program. Really helps change the trajectory of parents and children's lives. Some other work in progress. Again, I think I've addressed some of this. Tobacco retail licensing I hope to have in front of you guys hopefully in the next month or so. Okay, that one didn't get updated. Studying timesheet solutions, so we've got that addressed. Filling vacancies, I think we've filled 6 or 7 vacancies since my arrival, and I think we've lost 2 staff members, so we're in a net positive there. And again, revamping, recruiting, our hiring and onboarding procedures, updating the website, updating MOUs and MOAs with our partners, looking to have a backup deputy health officer, a contracted position, and then updating our environmental health software. So a lot of these you are pretty well aware of what's going on. So looking ahead, again, trying to start some more services. So additional STI screening and testing in the community and up in Oregon. I'm not sure if this will be allowed in California, but hopefully our insurance will allow it. But if somebody were to test positive on a rapid, starting at least a one-time administration treatment right then and there, and then referring them on to primary care. So that and that has a lot of success in knocking out a pathogen if you get to it early enough. So that's a nice way to utilize those rapid tests. Additional vaccine outreach. Again, we have the home visiting services getting started. We did get a grant for about $500,000. I believe that was probably the first contract that you guys approved since when I arrived. That's the path-cited grant for the community health workers. And so we're going through a TA marketplace right now to get a consultant to kind of figure out how to best utilize those community health workers and hopefully have some billable services through them too. And then again, the mobile outreach unit for education and some additional services. So yeah, we're studying the fees for services already provided to see if we're missing out on any potential billing there. We're trying to slowly clean and organize our building. Potentially, we're probably going to have to implement some additional remote work to address the space issues, especially if we do end up continuing to hire based on funding. So hopefully that stays. Increased use of artificial intelligence for efficiency for our staff. That could be writing press releases. It could be help writing with grants, helping do some of the getting forms and templates started. So that's a good use of AI to kind of help save 30 minutes to an hour in staff time. I'd like to get an internal audit contract probably set up, hopefully in early fall, just to bring more awareness of what we're missing, what we're not doing right, and so we can have more of an awareness of how to correct those things moving forward. That's a pretty standard thing that I've seen with some other health departments, and that's not happening here. Again, with all of our funding being one big pool of several different funds, it's kind of good to make sure that we know, hey, are we utilizing all the funds correctly? What else can we be doing to capitalize on some of these funds, and how to spend it properly? So. And then additional coalition building. So what do I need out of you guys? Please continue to be public health champions. Please help spread the awareness of all the good work that we're doing. We are moving in the right direction. I am seeing some very positive changes. I know that, again, this might come off as a little bit negative, this report, but again, if you can't be honest with yourself, you can't improve. So we're going to help support the transition from more of an administrative focus to service delivery focus. Support revisions of the org chart. I'm working with HR on that, and then our hiring process. When it comes to healthcare, if you're not in the middle of the pack with what you're paying, then speed is key. So you got to be the first of the line for job offers sometimes. And right now, I know that it's a pretty slow process. I don't want to come off as complaining, but that's something that we need to kind of work on and hopefully make it a little bit more efficient, so that we're first of the line at least making an offer, so we can get some key personnel, especially like when you're looking at nurses or community health workers. Anybody that's actively doing a healthcare service, they get offers pretty quick. So I think that's it. And thank you so much for your guys' time. Hopefully I stayed under 15 minutes. Any questions?
Thank you very much for your presentation. Supervisor Green.
Just never apologize for being truthful. This to me was a breath of fresh air. It shows to me that you have not just landed, you've dived in head first and have been swimming in uncharted waters.
Yes.
And I was excited to hear what's coming up short term. Quick process question. I love this slide deck. Hope we can get it posted with the agenda item after the meeting. And also, you didn't call it out in your needs, but if the building has issues and you have some hiring capacity, maybe the space committee would be another place you want to hang out to see if, because other county departments, they're also in flux too, and their increased use of teleconferencing.
Yeah.
We may have some space available if you're outgrowing your space or if you want to make some changes. So
Fantastic.
that's kind of a suggestion, and I don't know if there's board consensus, but I don't know if we need one at this point. But if you feel you have a space constraint, we do have a process for that.
Fantastic. Yeah, no, I didn't know about that. I have reached out to our partners at DSS, as I understood that they had some cubicle space, and they're located in Lower Lake, and that would be great. We just could utilize a couple cubicles, and especially for like our environmental health team, rather than drive to Clear Lake and Lakeport back and forth twice. They can do, most of their work is in Clear Lake, so they can go do the inspections, and if they live close by, then they can pop into the DSS building, do the reports and forms, and then go home. It saves so much time in driving and make things more efficient. So we are looking at some of those options to try to be efficient, both with our travel and our time, and also gaining a little bit of space too.
Right.
So
I'll look to my colleagues and staff to further advise you. Last thing, P&Ps, they're not hot, they're not exciting, but gosh, they're important.
Yes.
They're important for compliance, they're important for onboarding of staff. It can be super frustrating to land in a new job, be very excited, and not have adequate guidance.
Right.
And those P&Ps are there for a reason, and so go Team Health.
yeah, for sure.
I'm excited to see those come online. Thank you.
Yep. We have a committee that I hope will help take on some of that work, as well as I have some plans, if funding allows, to kind of start a workforce development and quality assurance coordinator that could help out with that. So fingers crossed on that one.
Any other comments? Appreciate your presentation. I know that I've seen you quite often out in not just meeting with agencies and going to other committee meetings, but I've seen you in the public as well. You're getting yourself immersed in the community that you've come to, so I appreciate seeing that. We knew we needed to make sure the foundation was strong, so thank you for bringing to us every aspect of what needs to be done so that you can have a strong foundation to really build on. I know that we have been looking at our health metrics for quite a while with hopes and desire to see that change. And so I'm looking forward to seeing this work plan come through. I know that, yes, it's good to look at the service-oriented part, but I'd like to still see public health or health services still be the umbrella of those changing of the metrics, leading the CHNA and things of the kind. But I know you are involved in those discussions.
Yes.
And will continue to be. So at this moment in time, I think you've painted a realistic picture of what it is that needs to be done. Happy to continue and support what you're doing. But I know that to me, the true goal is changing those health metrics, but you got to have a strong team and a strong foundation in order to make that happen. Happy to hear about the changes also in your net positive for your vacancies at this moment in time. That had gone down at least for one of your funding. I think it was, I don't know that it was public health administration. I think you have 3 sections. I think you have just a normal public health section that was down to like 60%. So I look forward to seeing that being built because you can't really get the job done if you don't have the people doing the work.
Yes, exactly.
So looking forward to it. Appreciate the presentation and thank you for the work that I've seen you do already from from the get-go. Actually, I will say one more comment, and I know Director Jones probably heard it. Friday, we had the opioid settlement, and there was a comment that there is no public health in the city of Clear Lake area, or at least in the South Shore area. And so I think if there's a way to look at some of those vacant offices and providing those services closer to some of those that have needs, I think everybody wins at that point. So.
Yes, I 100% agree. We do need to have some more presence in the high populated area, for sure.
Thank you very much.
Especially with its challenges there.
Yeah, absolutely. So thank you. And if there's nothing further, then let's go ahead and open it up for public comment. I see no hands in Zoom and no one getting up in the chamber. So I'll bring it back.
Just looking forward to the following, or I'm sorry, looking forward to the follow-up so that we can start tracking the improvements.
For sure. Excellent.
Yeah.
All right, well, again, thank you so much. And yes, I'm super happy to be here in Lake County. This is probably the most beautiful county I've ever seen. The people here are great, and this has been a really good, positive change for myself as well. So thank you so much for giving me this opportunity.
Don't go quite yet. I believe Supervisor Simon has a comment.
Just thank you very much, too, for the report today, Anthony. And, obviously, you talked about the business side of it, or the opportunity to see if we can create revenue in your department. But also, I like the home visit stuff.
Yeah.
This country's gone away from that. Doctors used to go to the homes, check on folks. I really think that's a great opportunity here in Lake County to go out and engage with the families and encourage them to do what they need to do. So
Yep.
I'll be excited to see how that moves forward in the next year or so.
Yep. And that team is working really hard trying to market and build up the caseload, and Kim has done a great job getting that program off the ground and going. So hopefully we see a lot of good progress in that. I'd love to see 50, 60 families on there, and we can continue to grow that team. It's like I said, it was quite popular in Oregon. I think we served probably 300 or 400 families a year with our home visiting services, and it just does enormous work inside the home from basically the time the woman gets pregnant, and it's guidance, it's resource help, it's getting people pointed in the right direction, which just makes a huge change in the trajectory of a child's life. So I absolutely 100% agree. I'm glad to see you guys are supportive of that.
And in rural environments, we know that our last CHNA, one of the top priorities was access.
Yeah.
And I think that is absolutely trying to attack the issue of lack of access to some of the more rural, more can't find the word, reclusive areas in our communities. And so making sure that we can provide that access. The mobile unit, I'm very excited about. Can't wait to see that happening. And the fact that we already did our first home visit is already a good start. So thank you very much for your presentation.
Thank you.